Thank you, Mr. Chairman. Mr. Dickin, last June, I led my House and Senate colleagues in a letter to then Secretary Azar, and then Administrator Verma, pleading for more resources, guidance, and support for nursing homes. At the time, New Jersey had already been on the front lines of the pandemic for over 2 months. 2 months when we were fighting in the dark against an invisible enemy. 2 months where New Jerseyans suffered immeasurable losses and pain. In that letter, I called for a comprehensive national testing plan. We didn't get it. I asked for a strategy to ensure our nursing homes had sufficient PPE. I asked for a plan on staffing shortages, and for how to care for COVID-19 positive residents. And I called for greater resources to improve reporting and communication. We didn't get all of those things. And when we did get something, it came slowly and for many too late. So that we can learn from the past, can you talk to us about the harm inflicted by the failure to put in place a national testing plan last spring?
Yes, thank you. And you're right, that is part of GAO's broader work examining the federal response to the pandemic. GAO has also recommended that there be a national testing strategy, and that has not yet been implemented. That's key for several reasons. The national testing strategy would help better target information on what resources and expertise can be used to try to control or prevent outbreaks. It also could assure more consistency so that there's working at state, federal, and private entities working on common goals, and that there be common information that could have more transparency.
Thank you. Dr. Gifford, I recently introduced the PREPARE Act and sent a letter with Congressman Pascrell to the administration requesting that infection control practices be improved in nursing homes to combat the future spread of COVID and other viruses. Your plan also calls for a new focus on infection control by adding additional requirements to the infection preventionist position that is required in all facilities. Could you elaborate on your plan and how these changes would help provide a healthier environment for the residents you serve?
Thank you, Senator Menendez, for all of your efforts on both PPE and infection control. We definitely have supported the infection preventionist program and requirements since the beginning. I think what we've learned is that you need to tailor that infection preventionist to the needs of the facility. A large facility with 300-400 beds needs more than one person. A 20-bed facility in a rural community does not need the same amount. You also have a facility that takes care of highly acute illness and very sick individuals may need more infection preventionists than those that have less acuity in there. And so we would strongly support it being evidence-based. You also don't necessarily want to say it has to be one person, because if that person gets sick or is out on vacation or not working those days, you want to have good coverage of infection preventionists throughout. So this should be able to be covered by multiple people. So we are asking for an evidence-based approach to addressing this infection preventionist in the nursing homes.
And one final question. Last week, the AHCA sent a letter to the administration asking for next steps for vaccinations at nursing homes. Now, last week, we learned that in New Jersey, only about half of our nursing home staff are vaccinated. Since the pharmacy partnership with retail pharmacies and nursing homes is drawing to a close, it seems to me we need to be sure we can still get people vaccinated in these facilities. What are some of the more creative ways the federal government can partner with our nursing home partners to reach the stated goal of 75% of staff vaccinated by June 30th?
Well, I think the initial plan they had, working with retail pharmacies and getting vaccine out there, was a highly successful program. I think the challenge now is getting vaccine out. There just isn't enough vaccine still coming out and being allocated into the program. And so no matter how innovative a program you have, there is no vaccine in the federal or being allocated out other than a handful of states. We need to not let the gains that we have seen with vaccinations slip. It's also clear, I think, as you heard from Ms. Ramos, that you need to have multiple people sitting down and listening and talking to staff and residents about what their concerns are with the vaccine, so that they can understand what's going on out there. And CDC is sort of working in that area, and we support that effort.
Thank you, Chairman.
Thank my colleague. We're going to keep